My name is Dr. Ashok Jain. I am a senior physician, MD Medicine. I'm practicing for last 4 decades in Neemuch as a consultant physician. Topic of today's discussion is gastroesophageal reflux disease in older patients. Now, the gastroesophageal reflux disease is such a common condition, particularly in the old adults, in our day-to-day practice, that most of us who are practicing in the field of gastroenterology, we see a lot of cases of gastro reflux disease. So today we have kept this topic so as to understand and to share our experiences with you. The symptoms in older patients may quite different from those in younger patients, and that gives them more pay attention to the changes. Now, GRD can be sometimes very harder to diagnose in older adults because they might not experience the classical symptoms of heartburn or chest pain as the younger patients feel. So instead, they are more likely to have the symptoms like the feeling of food coming back up, the difficulty in the swallowing, sometimes general stomachal discomfort, or say dyspepsia or indigestion, and sometimes the patient may have a nausea and vomiting, and sometimes they complain of chest pain that is not related to the cardiac problem. So the older adults, they are more likely to experience complications like the ulcer, the bleeding from the GRD, which the younger patient do not, which can make the condition more serious in these patients. So it is very important to recognize these symptoms quite early so as to give the proper treatment. The symptoms of GRD in the older adults, they are quite confusing because sometimes they may resemble those of other conditions. For example, they may mimic, or we have such as like the heart issues. We may confuse with some infections. We may confuse with certain digestive disorders. So many older adults have the multiple health comorbid conditions, which marks the GERD symptoms. Additionally, the changes in the nervous system may lead to some unusual symptoms in these patients, and the patient might dismiss this discomfort as a normal dietary issue. Even if the symptom seems vague, beyond the looking for the sign like the chronic cough. Now, the proper diagnosis is very important so as to manage the gastroesophageal reflux disease quite effectively, especially as I mentioned in the older adults. If you experience the symptoms, it is very important to take you to the healthcare provider. The GRD doesn't go away of its own, as you know, as you need for long-term treatment. And so our approach includes lifestyle modifications. Our approach includes the medications. Our approach includes sometimes the anti-reflux surgery in some cases. Now, what are the life changes that will help control the GRD? That is the shedding some extra kilos, elevating your head when your head end should be up while sleeping, the sleeping on the left lateral positions, smoking, quitting, not wearing the tight clothes, and limiting portion size by eating small meals. Frequent small meals are very important, and avoiding the late nights meal. Now, the certain trigger factor that should be avoided, which may worsen your reflux. For example, citrus foods, the foods rich in fats like chocolates, onions, garlics, all they cause the triggering of the gastroesophageal reflux symptoms. So be cautious with the certain medications. For example, the patient taking antacids after consulting a doctor, the proton pump inhibitors, they are the medicine which are quite effective in managing the symptoms of GRD, particularly in the older groups. The surgery is a quite certain times an option for the older adults, particularly when we have a very low resting pressure in a lower esophageal sphincter that is being confirmed by manometry. Do not respond. Sometimes the patient they do not respond with the medicines like the proton pump inhibitor for a longer period of times, and certain times we have a complication like the bleeding, hematemesis, or ulcer, and these are all severe complications of the GRD. Overall, these options they can help your symptoms and improve the quality of the life of the patients. So that is very important. Thank you very much for this opportunity to talk about gastroesophageal reflux disease. Usually, very often we talk in the younger patient, but this time we choose this topic in the elderly patients, where the symptoms were quite different sometimes with the older patients, younger patients. So we have to identify in our OPDs while making the diagnosis of GRD, either by clinically or by endoscopically. So the symptoms sometimes quite vary, and it mimics certain other comorbid conditions that we have to rule out. So thank you very much